Welcome back to the show. Do you turn to Dr. Google when you have a health-related question? Well, I know many people that do. Should we, shouldn't we? Well, Dr. Zach Levine is here from the MUHC to answer some of our questions. And before we get to that, we're just talking about the budget rolled out. I just wanted to get your opinion. You know, you're in the healthcare industry, you're in the field, you felt the cuts, I mean, really heavily. Although we're seeing a 4.2% increase, obviously not to the level that we had before the cuts happened, but what are your thoughts on the Quebec budget?
Well, yeah, you know, it's hard to argue with funding and support for healthcare and education. But yes, we've definitely felt it. I'm certainly happy they're going to be supporting, they mentioned decreased wait times, and they mentioned also nurse practitioners. That's great. There's a lot of people who have felt it. A lot of people who are feeling burnt out, and certainly patients, you know, patients more than anyone are feeling it. So if they can decrease that burden, then I hope that happens.
When you hear about this funding, though, I wonder from your perspective and in the healthcare industry, how long will it take for you guys to see even the effects of this increase?
That's a good question. I mean, one thing I noticed is it didn't take too long for us to notice the effects of the cuts.
Yeah.
So if it can bring us back, you know, some semblance of more support, and especially patients not waiting as long, then that's great. We shall see.
Well, let's get over to Dr. Google, because many people go online. I have family and friends that do it.
Oh, yeah.
Is this something that people should do? Are there some positives to this? Because I can imagine there are some negatives as well.
Yeah, well, you know, we know people do it, you know, and it's not a bad thing. I mean, there's so much information available out there, and that's fine. You know, people should be informed about their health care. And apparently 1 in every 20 Google searches is health-related. And when you think there are 3.5 billion searches every day, it's a lot of healthcare-related. So whether people should do it, you know, absolutely. I think it's unrealistic to think that they shouldn't. And I certainly support people being informed consumers of their health care, because you want them to be involved. You don't want it, you know, in the olden days it was the doctor had all the information and they just said, okay, take this or whatever. Now people are really an active part of their health care, so I think that's a very positive step.
And I think even a generation or two before, you felt you had more time with your doctor. I feel that, you know, you're kind of rushed in and out, and not necessarily at the doctor's fault a lot of the times, but there's just not the same amount of time that you're allowed to.
No, absolutely. No, the time is much shorter. So if you can do extra research on your own, that's great. Now, the issue is always where you're getting the information from.
Right.
You know, so my best advice is to be somewhat skeptical. You know,
okay.
If you feel like someone is selling you something, because I mean, oftentimes that's what is the motive of these people whose site you're on. You know, if they're trying to sell you something, or if there's some miracle cure, then doubt it. You know, obviously I'm biased towards things that are governmental, or the CDC or the World Health Organization, or things that end in .org or .edu, or even there's a MUHC patient education site. You know, these are sites that are really, they're meant to educate the public, and they don't have an agenda. You know, they're not trying to get you, to work you towards a certain site to buy a certain medication.
There are some programs out there, too, with symptom checkers, for instance, which give you a diagnosis. Do you know any statistics on that? I mean, are they working
studies.
at all? Do they help?
No.
Okay.
I mean, they're not
the
terrible.
short answer is no.
They're not absolutely awful, but when they've done Harvard not that long ago did a big study, and they looked at about 23 of these sites, and in general, they got the correct diagnosis, #1 diagnosis, about a third of the time.
Okay.
So that's not very good, right? And it was pretty typical presentations. Like they would enter quite typical presentations, and the site would be wrong most of the time. Now, it would probably get it in the top 3 or the top 10, but now the other thing is they have to err on the side of caution. It's sort of like Info Santé.
Right.
Although Info Santé, I think, is more useful because there's an actual person there, but you have to err on the side of caution. So you can't, if someone says I'm having chest pain, you can never say, it's nothing, you know.
Yeah.
Just forget it. You know, because what if you're wrong? You can't afford to be wrong.
Because even Info Santé, you call them, and you know they have to protect themselves as well, right? And you can say so. Oftentimes, I hear from people, they send them to emergency because I guess they feel they have to.
Exactly.
Right?
Yeah. You have to err on the side of caution, and that's what these sites do. Especially most of them are American sites.
Right.
They're all open to potential lawsuits, so they can't say, it's nothing. What if it's not nothing? You know, but they can give you. So I think it's much more useful to look up information. If you have a diagnosis, for example, that's more useful. If you go to a good site, you can get a lot of information that your doctor may not have time to tell you about.
You talked about being an active participant. One thing I find very difficult: you go into the doctor's office and you may bring up something. They ask you, "Have you had it before? And when did it happen?" and so forth. And that information just doesn't come to you, right? Because you know, when you get into your sort of 30s, 40s, you wonder, 10 years ago, was it 5 years ago? Can you ask your doctor for the information, like for your information, your sort of medical history, that you can keep your own files?
You can, absolutely. I mean, in my opinion, the patient record, the information about you should be yours, in my
Right.
opinion. There are laws pertaining to that, and I'm no lawyer, but certainly, when I see someone and they ask me, can I have a copy, I always try and give, especially because I'm in the emergency department, I
Right.
say, here are your results, bring this to your doctor, because certainly in the emerge, I don't have a lot of time with them. So I say, here are your reports, here are your blood tests, here are x-ray results, bring it to your doctor, you can talk about it more.
Dr. Zach, always a pleasure having you on the show. Thank you very much. Really
Thank you.
appreciate it. There are a lot of information when it comes to Dr. Google and things you should do. If you visit our website, btmontreal.ca, click on our blogs portion of the website, and we have a lot more information available for you. We'll be back with more Breakfast Television right after this.